Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. Today's guest is someone who I just fell in love with on Hit the Trails. I ended up meeting her with the Like a Girl podcast. Her name is Sara Gallo. She's a PA, and she's also VP of Clinical Services at Care on Location. Welcome, Sara.
Yeah, thank you for having me. It's an honor to be here.
Yeah, so I'm excited to learn about remote patient monitoring, your experience with it, but before we dive into that, tell us a little bit about yourself and Care on Location.
Yeah, so I'm a PA by trade, a physician assistant, and I've been working in primary care for the last 10 years. Basically, I worked in, I managed my own patient panel and took care of over 2,000 people in a year's time. Wow. Over a period of time, but also then have moved into a position at a telemedicine startup called Care on Location that mainly looks for, implementing solutions using telemedicine to meet patients in the safety net population. So specifically Colorado Medicaid is what we've been focusing on so far, and I'm actually in charge of the provider and patient experience and optimizing that so that it is enjoyable experience for all.
Awesome. So you've had a lot of experience with patients, and I think you were doing remote patient monitoring before it became remote patient monitoring, but what was your experience like working with patients this way?
Yeah, so there is a lot of benefit to gathering that data in between the patient visits that they come into the office, and really the old school was telephone and asking for their vitals that they were collecting on their own and making adjustments that way, and also having just that communication in between, which helps patients to understand what to do, but also give them the opportunity to communicate that they may have something off. So that was essentially, before there was any billing around it, and before there was even this different industry. But since it came around, I think there is some benefits to having a system and basically a program within your practice for it.
Well, it sounds painful to do it by phone, right?
Yeah.
It's interesting when you look at health IT, there's so many things that were just either impossible or extremely painful to do. Remote patient monitoring by phone sounds misery to me. So what do you really think is the most effective way? What are the things that you want in a remote patient monitoring solution?
So I think that there is an important factor of giving a patient the incentive to actually gather that data, not just on a prescriptive mindset, but what does it give back to them? So very much so, having that educational component of what do these numbers mean as engagement, but also to give to ask some more questions beyond just the vitals data, so that they feel like a person rather than just a robot giving their vital and delivering it back to this place that's monitoring them. So some communication and understanding.
Yeah, I think it's interesting. It is a change in mindset for the patient as much as it is for the doctor.
Yes, and I think part of the one benefit is that if you're having a remote patient monitoring solution, you can actually provide some of that data that normally we would have to really hone through and spend some extra time mining that data that's coming in from the patient and maybe isn't very actionable, and instead having something that can actually decipher some of those vitals and data stuff to actually interpret it so that I can actually do my job more effectively and efficiently. But also teach the patient, okay, this is something you really should do something about versus, okay, we're just monitoring you.
Yeah. So how about disadvantaged communities? Is this model more effective, less effective, or maybe a mix of both?
So I think there is some really great benefit because there are inherent, issues within the safety net community that really prevent them from accessing care altogether. So if that is already identified, maybe remote patient monitoring because they have a chronic condition that should be monitored, they will be able to actually access care more because they have a solution inside their home that can now become a device for telemedicine, but also to be a device that can monitor them if they don't have access to all those tools. They can get that as part of their healthcare services, but also the provider, managing them can then improve their health, and they also have taught them something in order to keep having them practice that those good habits because the remote patient monitoring program actually taught them to be checking their vitals on a regular basis.
So what do you need as a clinician in a remote patient monitoring platform? I know you've looked at a lot. You work with, care on location, of course. And what do you need to really do this effectively? And maybe what do you wish they'd still add?
Yeah, so I think the biggest thing, like finding with all the solutions, is making sure that there is that implementation plan, and also help with implementing it for that particular practice, because so many practices, are practicing very much in a silo. They do things the way they do them, and a remote patient monitoring solution may be really good from like a visual standpoint, in sense that like, yes, this will do what you need it to do, but how do we work that into our workflow so that our staff really doesn't feel burdened by it, and therefore can then be advocates and champions to help these patients adopt it, because it is also another thing for patients to adopt as well. So having that in understanding of what kind of barriers with our patient population we're going to have to deal with, and what kind of solutions have they already figured out because they've implemented it in more than one practice, would really help, I think, any practice. When I was trying to figure it out, I think also billing and just understanding that, which I think a lot of them do a good job at, educating, because it is such a unique billing kind of process.
The documentation.
Yeah, and there's all these other pieces, but like, yes, there's other things that, this worked in this practice, this didn't. And then also being able to have almost like a health checklist for the practice to make sure that all those things are covered, so that practice is very successful in implementing it to a large population, because it is a big lift for a practice. So having somebody that knows how to work in that clinical space and be able to interpret it for that clinician, and their administrators too.
Yeah, I think it's interesting that you said that if it's implemented the wrong way, or if it's not implemented effectively, that it can be a burden on the clinician. Because I've heard the opposite as well, which is many clinicians love doing this because this is why they got into medicine. So it's interesting, the kind of that double-edged sword, that it's like done wrong, it could actually cause more burnout.
Yes.
But done right, it could remind them of the passion they had for healthcare.
Well, and ultimately, we all want our patients to be healthier. We don't want to necessarily be needed. And so, I think that's the biggest thing is is this solution actually making it less, making these patients' health better? And if it's not implemented properly, it could just be a bunch of data collection that doesn't change anything. Or it could be actually a reason to cause, issues between the patient and the clinician, because there's just so many, pieces moving, that if it's confusing, it will then, maybe turn the patient off to even wanting to participate. And we don't want our patients disengaged. We want them more engaged. But this is an opportunity to have at least like a solution inside their home that connects the two of us. And on top of that, really can help identify maybe some things that we just didn't even know were part of the healthcare treatment plan that were barriers. I didn't realize they had a snack at night and they didn't count that, or they weren't checking their blood pressure at the right time, and so it was always high, but we were over-treating them, things like that. So it can be really valuable, and there's other opportunities for the programs themselves to implement other kind of key identifiers about their population that like about access to good food, what is your home life like, because they're letting you be in their home, so it kind of opens up that vulnerability as well. So you could definitely, as a practice, take advantage of being able to be more intimate with that patient and their other lifestyle issues.
I'm feeling a little vulnerable by that snack example. No, it's good. So tell us about the solution that your company, Care on Locations, created.
Yeah, so we have basically offered up telemedicine to the Colorado Medicaid population by partnering with the managed care plans, but also we've built telemedicine hardware, cases, cards, backpacks, in order to be able to like meet patients where they are, and then they are equipped with ways to capture that those vital signs, also be able to listen to the heart and lungs, take a look in your ear, your throat, and be able to then see a provider on the other side of the telemedicine screen to really get that care access, even without moving from wherever they are. They could be in a homeless shelter, they could be in jail, waiting for to be released. They could also be in another country where they're needing access to care, and the only care is somewhere else. So, but we still get to provide the same quality visit. And that's kind of the nice thing about having remote patient monitoring in your own home, but also doing just using a community health partner to then bring a kind of pop-up clinic to that community that already is accessing other resources in that space. So we try our best to at least find solutions so that access is not as much of a issue.
I think it's so cool. I mean, we're here in Las Vegas, and I saw the first kiosk that had all of that, the telemedicine, it had the various devices, and you've essentially taken it from this massive kiosk that was super expensive and put like telehealth in a box. And that's a pretty cool idea.
Yeah, and I mean, I think it like works really great because you can, those patients who aren't necessarily able to access care, those are the most vulnerable populations for having issues with their health, but that's not just that. There's so many other pieces to it. So if we could take away that barrier of even transportation, having a trusted provider. So we do this all the time. We see this population, like we are a safe place, but you don't even have to leave where you are, we come to you, I think really provides that sense of trust and safe psychological safety. But then, at the same time, let's utilize this technology. I think it's really valuable, and I don't think it lessens any quality that visit actually has.
Yeah. This is awesome, Sarah.
Yeah.
I appreciate you being here, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Sarah.
Thank you.